Hello, my name is Dr. Keith Brady. I'm a veterinarian with Old Dominion Equine Associates here in Keswick, Virginia. And today we're going to go over how to assess your horse's back. So this is part of my musculoskeletal exam that I will have already palpated the neck, the limbs, the hindquarters, and for this portion of it, we're looking just at the area that would be where the saddle sits. So the first thing is we have the skeleton running straight down the center and the epaxial muscles, which sit off to the side. And it's very important to assess both of those separately because sometimes you have pain in the dorsal spine, such as kissing spine, or sometimes you have pain in the muscles. And so first we're going to get the horse to bear even weight on both hind legs, and that's very important to make those spines stand up straight. So we'll put direct pressure straight down the center and check for any movement. You'll usually get a little bit of movement, and that's just enough. It's very important that you don't tickle the horse. There's a lot of horses have a paniculus response, it's called, where the horse will move with very light pressure, and that doesn't mean anything. That's a normal process. We're palpating through several inches of tissue, so you want to use deep, firm pressure with that mindset that you want to know kind of what's going on down in there. So after we've palpated the spines, we're going to move off to the side and the muscles, and we're going to start right behind the shoulder blade, and we're going to palpate with deep pressure all the way through there. And again, some movement is normal. And then we go on to the back, which I'm going to leave that out. And then finally, we're going to ask the horse to lift his back up and make sure that there's a normal movement there. You're looking for either a horse that evades the pain when they're asked to lift the back, or a horse that's kind of locked. They won't lift their back at all. Both can be a sign of a problem. So that's about it. Those are the two things. Just remember, palpate separately, the bone in the center and the muscles off to the side. You're going to repeat that on both sides, and then the back lift. And that's something you can easily do yourself, but what's most important is that you do this same exam on numerous different horses and really get a sense of what normal is, so that when there's a difference, you'll be able to appreciate it.